Greetings, viewers, and once again, I want to welcome you to my YouTube class. In today's class, we're going to be talking about another platyhelminths, which is called Paragonimus westermani. This platyhelminths parasite is a member of the fluke. I mentioned the different examples of flukes: the schistosoma, the fasciola, the Opistochis sinensis, Gastrodiscoides hominis, Trophis, then and the rest of them, Dicrocilium, the Triticum, and so on and so forth. So one of them that we've not talked about is a Paragonimus westermani. And the Paragonimus westermani is also known as the Oriental lungworm. We have different types of flukes. We have the blood fluke, the schistosoma, we have the liver fluke, the fasciola, we have the intestinal fluke, fasciolosis buscae. Then we have the lung fluke, the Paragonimus westermani. These are the four different kinds of flukes that we have. And that is what we want to look at. I've said that it is also called a rental worm. And in terms of size, we discovered the size of this parasite is between 7 to 12 millimeter long. And it stays in the lungs and produce eggs. That means it matures into adult in the lungs, and that is where the parasite produces eggs within the lungs. That is where they mature into adult, and of course begin to churn in eggs. Then they have two different suckers, two different types of suckers: the oral and the ventral suckers. And of course, the oral and the ventral suckers help the parasite in anchoring within the body of the host. Then, of course, it has a spiny tegument. This tegument is a kind of thick covering that is made up of little or tiny spines. And of course, these teguments also help the parasite to anchor within the lungs of the host. And apart from that, you discover that it also helps to protect the parasite against the enzymatic action of the host, and it also helps in absorption. It helps the parasite in absorption of nutrients. So these are some of the functions of this spiny tegument that is found within this parasite. Having thought about these few characteristics, then it is important to also just look at the classification of this parasite, Paragonimus westermani. Now, the kingdom is Animalia, and the phylum is Platyhelminths, and the class is Trematoda, and the order is Digynia. Then coming to the family, Troglotomatidae, then the genus is Paragonimus, then of course the species is westermani. Don't forget I said this is a long fluke. It is found in the lungs, it is in the lungs that it grows into adult and of course begin to lay eggs. Now, having explained this, it is now important I begin to talk about the life cycle of this parasite that is called Paragonimus westermani. Life cycle of Paragonimus westermani. Now, in terms of life cycle, you discover that the adult worm, like I've explained before, are found within the lungs, and since they are found within the lungs, they lay their eggs within the lungs there. Then, of course, humans cough up these lungs, and of course, they are avoided or probably land within the sputum. And within the sputum, the individual, of course, may swallow the sputum. And once the sputum is swallowed, then the parasite, the eggs of the parasite, shrouded within the sputum, lands in the intestine. And once it lands in the intestine, when next the person passes out feces, the eggs of this parasite goes out to the feces to the external environment. So there are two different ways through which the eggs of this parasite can be released into the external environment. There are two different vehicles that help to carry this parasite into the external environment. The number one vehicle is the feces of the host, because when the parasite lands within the intestine, of course, it passes out through the feces into the external environment. And another way is through the sputum. Now, some of the parasites will still hang within the sputum, and when the person cough out the sputum, of course, the eggs of the parasite will be with that sputum. Let's assume that the individual who is suffering from Paragonimus defecated in an aquatic environment, because this is also a parasite that requires aquatic environment for the perpetuation of its life cycle. So, assuming that this individual defecated in an aquatic environment, or probably while swimming, coughed out sputum within the external environment, then what will happen is that the eggs of this parasite will hatch into miracidia. And once it hatches into miracidia, then the miracidia will now penetrate the first intermediate host, which is the snail. Once it penetrates the first intermediate host, which is snail, then of course within the body of the snail, it transforms into the sporosis, from the sporosis to the radia, then from the radia to saccharia. Once it forms saccharia, it leaves the body of the snail, which is the first intermediate host, looking or locating the second intermediate host, which is usually a crab or a crayfish. Once it gets, once it locates this second intermediate host, it also burrows its way into the body of this second intermediate host. And once it's finds itself inside the body of this second intermediate host, then it is carried within the guts or within the muscles of the crayfish or the crab. Now, in this muscle, that is where the parasite transforms again into another stage, which is now called the metasaccharia. And this metasaccharia is similar to the metasaccharia that we mentioned in the case of fasciola. The difference is that the metasaccharia of fasciola encrests itself within the watercress, which is the second intermediate host. But in this case, this metasaccharia encrests itself within the muscles of the crab or the crustacean. And that is where it remains until when next an individual, which is the definitive host, of course, like man, takes up the raw undercooked crustacean or crab, then the parasite gets into the body. As a matter of fact, because it insists as metasaccharia within the muscles, then when the human or the definitive host ingests this crab or crustacean, then it exists within the duodenum. And once it exists within the duodenum, the parasite now penetrates the intestinal mucosa, passing through the peritoneal cavity and the diaphragm, and of course through the pleural cavity, and lands within the lungs or reaches the lungs. Once it gets to the lungs, that is where it says to mature into adult. And by the time they mature into adult in the lungs, they begin to lay eggs. And as they lay eggs, that individual can cough out, can be in the process of coughing, cough out the eggs, and of course, the eggs mixes with the sputum, and the sputum is swallowed. Some gets into the intestine where it passes out through the feces, some remains in the sputum, so that when the person coughs out, the eggs are within the sputum. So that is what happens, and the cycle is repeated. I don't know if you understand the life cycle I just explained now. So, but even if you didn't understand, let me try to draw the life cycle. Let me try to draw it. With this drawing, you can now see that it's very, very simple. So I said the life cycle begins by the uh, discharge of eggs in sputum of feces. Then eggs hatch in water into miracidia. Then the miracidia penetrate the snail. Within the body of the snail, it transforms into sporosis, then into radii, then into saccharia. Then the saccharia leaves, penetrates crab or crayfish, or crayfish. Then within this crab or crayfish, okay, the crab and the crayfish are now swallowed, ingested by man, exists in the duodenum, then penetrates intestinal, mucosa, then lands in the lungs. Then of course, it is now discharged through the sputum or the feces. So I'll go to the life cycle again. So I said the life cycle begins by the discharge of eggs in the sputum or feces. These eggs can be discharged either in the sputum or in the feces. That is where it lays the eggs in the lungs, and of course, the eggs are then discharged to the sputum or to the feces. And I have explained how it lands within the feces. By the time the eggs are mixed within the feces, the individual, of course, swallows the feces. Remember, those parasites I mentioned that pass through the respiratory tree, the Ascaris rhombicoides, Strongyloides saccharialis, Esarasoma dodonine, Americanus, they pass through the respiratory tree, the bronchioles, the bronchi, the pharynx, the trachea, then the pharynx, mixes with the sputum, and then swallowed. So there's every is easy, or there's every possibility that the individual swallows the sputum. And once the sputum is swallowed, it lands within the intestine. Once it lands within the intestine, of course, the person can now pass out the eggs of the parasite through the feces. So, when these sputum or feces are released, carrying the eggs of the parasite, they hatch within water. And they hatch into miracidia. Don't forget that we also mentioned miracidia in the case of schistosoma and fasciola. So, it hatches into miracidia. Then this miracidia penetrates the body of the snail, and within the snail, it develops into transforms into sporosis, then into radii, then into saccharia. Then this saccharia, of course, leaves the body of the snail, trying to locate the second intermediate host, which is the crab or crayfish. And once you locate it, then it penetrates this crab or crayfish, then remains encysted or transformed into metasaccharia. I didn't write that. So let me just put metasaccharia here. Metasaccharia. So within the crab or fish, it encysts within the muscles to form what is now called the metasaccharia, which is the infective stage. Now, this metasaccharia is ingested when man ingests crab or crayfish. With this ingestion, the uh, encysted metasaccharia encysts. Of course, we have encystment and encystment. Encystment is when a cyst covers the parasite. Then when the cyst is being broken, that is encystment. So I know this is something that is common. I mentioned this, I've been mentioning it, especially when we started with entamoeba histolytica. Then, of course, it penetrates the intestinal mucosa, passing through it penetrates the intestinal mucosa, yes, passing through the peritoneal cavity, the diaphragm, and the pleural cavity. Then, of course, it reaches or lands within the lungs, and within the lungs, they mature into adults and begin to lay eggs, and the cycle is repeated. So, this parasite, what does it cause? In the case of pathology, it causes chronic cough. Chronic cough. And of course, since it's likely going to cause injury within the lungs, So since this parasite since this parasite is likely going to cause injury within the lungs, that means that there could be stains of blood. So the person is likely going to cough out blood. So chronic cough with blood stained sputum. That sputum that the person coughs out, may have stains of blood. Then of course the person may begin to have chest pain. There's possibility that the person may begin to experience chest pain and shortness of breath because the parasite passes through the respiratory tract. So the individual may begin to have a shortness of breath and some other uh, effects that come with this parasite. So these are some of the pathological effects of this parasite. Then of course the lungs could be inflamed. Yes, the lungs could be inflamed, and of course the inflammation of the lungs we know is a pneumonitis or pneumonia. So these are some of the pathological effects of the parasite. Then in terms of diagnosis through the demonstration of the presence of the S in the fecal sample or in the sputum sample. So the individual assesses the lab scientist assesses the sputum to investigate and see if the S or the parasite will be found in the sputum or within the feces. So these are the two different vehicles, like I mentioned before, that are likely going to carry this parasite, the sputum or the feces. Then apart from this, I've talked about diagnosis, pathology, then, of course, prevention and control. Prevention and control. How do we prevent and control this disease? A human should avoid eating of raw undercooked crab. Since raw undercooked crab is a carrier of the infective stage of this parasite, then individuals should stop eating that. Then, of course, there should be increased awareness of the disease. Some people don't even know. Paragonomiasis is a kind of a disease that is not too prevalent, but of course, it's still within the population. So, is less is underreported. That is what I want to say. It's underreported. So, there should be increased awareness of this disease. Of course, it will go a long way in preventing and controlling it. The snail intermediate host, should also be controlled because if we can address the intermediate host, of course, it will truncate the life cycle of this parasite. Then treatment. How do we treat this parasite? The use of triclabendazole can work. Triclabendazole can work. Then praziquantel can also work in treating this disease. So these are some of the headings under Paragonimus westermani that I think are important that we should know. Okay, I think this is how far we can go. Then maybe in the next class we'll look at other parasites. Okay, under prevention and control, let me also add it. Okay, I've thought about that. Poor hygiene, yes, poor hygiene is also part of it. That is under epidemiology. Mhm. Under epidemiology, poor hygiene is also a factor that can result to the the uh, spread of this disease. Then let me also add under diagnosis. I forgot to mention that microscopy can also be used in the diagnosis of this disease. Of course, PCR can be used, trying to mass produce the genetic material, produce the genetic material of the parasite within the sputum sample. The serological test, that is ELISA, enzyme linked immunosorbent assay. The ELISA method, that is serological test. ELISA method, that is enzyme linked immunosorbent assay. Enzyme linked immunosorbent assay. This can also uh, assist. That's serological test. Then imaging, chest X-rays or CT scans can also show lung cyst or lesion. Then one can also do CT scan, eh? CT scan, CT scan. That is chest X-rays, chest X-rays. Then these chest X-rays can kind of give the picture of the lungs and see if the cysts of these parasites, that is the encysted parts of the parasite, are found within the lungs, to show the lung cysts, to show the lung cysts. Okay. Formation of lung cysts, of course, that is one of the pathological effects which I forgot to mention. Formation of the lung cysts. So, ladies and gentlemen, I think this is how far we can go for Paragonimus westermani. I will see you in my next class. I'm still Dr. John Anoke.